Hi, welcome to J Sweat Plastic Surgery. I'm Dr. Jeffrey Sweat. You're being asked to watch this video today as a general introduction to the practice. It is our goal here that you are taken care of in a state-of-the-art facility, but also that we make sure that you're comfortable and that all of your questions are answered. This is definitely a team approach. As an individual surgeon who operates anywhere from 3 to 4 days a week, I rely on my team around me to help with your care throughout the entire process. I have also surrounded myself by people who are highly educated about what we do, so oftentimes they will answer your questions. If you have any questions that they can't answer, obviously they'll talk to me and we'll make sure that we have all of your questions answered. But it is important to understand that it is a team approach, and oftentimes throughout the surgical process you will interface with me from time to time, but you will often interface with my staff more frequently than you do with me. And this is so that we make ourselves available to you at all times and any time that you have problems. Obviously, we will provide you with an emergency number that you can call after hours, but when our office is open, it is always best to call the office to get the fastest response. If you have any questions or concerns about the process and how we are taking care of you as a patient here at J Sweat Plastic Surgery, please don't hesitate to ask. Thank you and welcome to the practice. The purpose of this video today is to discuss body contouring surgery. The reason that you're being asked to watch this video is that you're considering body contouring, usually of the extremities, whether it be a brachioplasty or arm lift, or a thigh lift, which can be either a medial thigh lift, which would be the inner surface of the thighs, or sometimes a circumferential thigh lift that goes all the way around. The reason that we do body contouring surgery is that people can develop loose skin, especially after massive weight fluctuations, whether it be pregnancy or massive weight loss. And sometimes people will be left with skin that does not have the elasticity, and thus they have extra skin and sometimes fatty tissue of various areas which would require contouring. The most important thing to understand is that the trade-off for the body contouring surgery is making a scar. Especially when we talk about brachioplasty, that becomes important because usually for a brachioplasty incision, the scar is going to go all the way from the elbow to the armpit. Many times people come to plastic surgeons because they believe that they want to have no scarring afterwards. Plastic surgeons always make scars through surgeries, but we put them in places where they're not visually noticeable, whether it can be hidden in clothing or underwear or a bikini. The downside of this particular type of body contouring surgery is that sometimes the incisions are placed in areas where they can be seen. The other problem with specifically the brachioplasty incision is that once the incision is made, the arm tends to swell a lot. So even though I pull things as tight as I possibly can to close the incision, over time the skin is going to relax again. The tighter or more tension that we place on an incision, the wider the incision tends to get with time, or it can lump up and become thicker than what we'd like it to be. Again, with a brachioplasty incision, that can mean that the incision is located in areas where it's very difficult to hide the incision. It is also important to understand that the more tension that's placed on an incision, the more risk there is that the incision itself can pop apart over time because of the tension associated with the incision itself. With any surgery, there's a risk of bleeding, infection, and scarring. Most commonly with this type of surgery, drainage tubes are not used, but it is important to understand that fluid can accumulate underneath the skin, and occasionally we do have to drain the fluid out here in the office by placing a needle through the incision. It's not terribly painful, it's more of just an inconvenience. Again, the downside of the body contouring surgery is that we do place a scar, but that scar is going to fade over time. With the inner thigh lift, we're trying to hide it in the groin creases, and again, with the arms, it tends to be a little bit more visible. General risks associated with surgery, there's always the risk of asymmetry. There's the risk that the laxity returns over time, although usually never to the position of what it started in. There's the risk of lumpiness of the tissue that can take time to calm down. There can be change in sensation and even loss of sensation. With the arm specifically, we worry about the motor nerves that run in the arm. Luckily, they run very deep and the risk of injuring a motor nerve is very low, but if a motor nerve were to be injured, it could cause a decrease in function of the hand. The surgery is almost always done as an outpatient surgery under general anesthetic, which means you're going to go off to sleep for the surgery. When you wake up, you'll be in a compression garment that we will provide for you. That compression garment is to be worn day and night for upwards of 6 weeks after surgery. It is important that you relax and take it easy after surgery with no heavy lifting or aerobic activity, with those activity restrictions extended for 6 weeks after surgery. However, it is super important that as soon as you get home from surgery, you're up moving around as soon as possible after surgery. Every hour or so, you need to get up, go to the bathroom, get yourself something to eat. Just be up moving around the house. You don't have to do it at night while you're sleeping, but it is important that you're up moving around, because if you're laying around too much in bed and not active enough, you can develop blood clots in your legs, and those can travel to your heart and lungs, which can be fatal. We don't want to have that happen. So it is important that you're up moving around after surgery. It is also important to understand that with body contouring surgery, we're oftentimes tightening things as tight as possible, which can decrease the blood flow return to the heart, which also increases the risk of developing those blood clots. So it is important that you're up moving around as soon as possible after surgery. While we expect great results after any surgery, there is the risk always of having complications, which can require further surgery or potentially a revision surgery to change the contour that we've created if there are any contour irregularities. We do have a formal revision policy, which I would encourage you to look at and make sure that you're familiar with before we do the surgery itself. Thank you for listening, and if you have any questions or concerns about what I've talked about, please let me know.